Okay, so I'm knocking the door and I'm checking the sign to see if I need to put on any PPE clothing. I'm entering the room. I'm saying, "Hello, Dawn. I'm Abby. Today I'm your CNA. I will be assisting you with a partial bath. Can I see your wristband, please?" I'm going to check her wristband, ask her when her birthday is to make sure that they match. I'm going to get clean linens and place them on a clean surface. I'm going to make sure that I need all the items that I need. I'm going to put paper towels over the overbed table and place my items on there. Then I'm going to close the curtain for privacy, and I'm going to lower the bed to the lowest position. I'm going to wash my hands. I'm going to put on gloves. I'm going to make sure that the other side bed rail is up, and I'm going to put my side down. I'm going to fill my water basin 2/3 with water to about 110 to 115 degrees Fahrenheit, or if the nurse says otherwise, I'm going to double check and make sure. I'm going to put my elbow in there to check the water temperature. I'm also going to ask my patient if it's comfortable for them. If not, I'm going to change water as needed. And if I do have to go change the water, I'm going to make sure that bed rail is up while I go change the water. And so I'm gonna put the water basin on the overbed table. I'm going to place my patient into Fuller's position or on the bedside. So today I'm gonna do on the bedside. So I'm going to make sure that this side rail is down and that side rail is up. I'm going to I'm going to help my patient undress. I'm going to use a bath blanket for privacy. I'm going to tell my patient just to wash the easy to get to parts, and I'll wash the back and the other places that they could not reach. I'm going to place the call light next to my patient and have them signal whenever they're done or whenever they need assistance. I'm going to remove my gloves, throw them away. I'm going to wash my hands, and I'm going to leave the room. I'm going to return to the room when the call light is on. I'm going to knock before I enter. I'm going to wash my hands, and then I'm going to change the bath water and make it the same temperature comfortable for my patient. I'm going to ask my patient what was washed. I'm going to wash the other parts my patient couldn't. I'm going to make sure that the face, hands, underarms, back, perineal area, and butt. I'm going to make sure that those are all washed because that is what is washed in a partial bath. I'm going to remove my gloves. I'm going to wash my hands. I'm going to give my patient a back massage. I'm going to apply powder, lotion, or anything necessary. I'm going to help my patient put on clean clothes. I'm going to assist if they need their hair brushed or any other necessities that they need. I'm going to make the bed, and then I'm going to make sure my patient is back and comfortable in their bed, and depending on the care plan, if the side rails are up or down. I'm going to ask my patient if they're comfortable, if they need anything else from me today. I'm going to replace the call light next to my patient. I'm going to lower the bed to a safe position. I'm going to put on clean gloves to empty, clean, rinse, and dry my bath basin. I'm going to use my paper towels for drying the overbed table. I'm going to return my supplies back to where they were. I'm going to open the curtain. I'm going to check the room to make sure nothing can harm my patient, like toothpaste, mouthwash, toothbrush, any sharp objects, anything that can harm my patient. I'm going to make sure that is put away. I'm going to follow the agency policy for where to discard the used linens. I'm going to remove my gloves, wash my hands, and leave the room to report and record my observations.